Welcome once again to SoCo Chat, a podcast where we hear directly from county leaders, discuss the latest news, and talk about all things concerning our beautiful corner of California known as Sonoma County.
Welcome back to SoCo Chat. I'm your host, Matt Brown, Deputy Communication Manager for the County of Sonoma. Thank you for joining us. Well, it's that time of year again, airborne virus season, which ranks right up there with tax season as most people's least favorite time of the year. This year, experts are warning of an increase in the usual triad of winter viruses: influenza, COVID-19, and RSV. This comes at a time when federal vaccine guidance has become even more confusing than ever. Public health officials in California are also dealing with a vexing surge in wild mushroom poisonings, which have sickened several people and killed one Sonoma County resident. Here to help us answer our health questions today is Dr. Michael Stacey, Sonoma County's interim health officer, who was appointed to the position in November. Dr. Stacey served as chief medical officer at Lifelong Medical Care in Berkeley. Before that, he served as the deputy health officer for Sonoma County, and he's also served in the United States Air Force and practiced medicine internationally. Dr. Stacey, thank you so much for being on SoCo Chat.
Yeah, glad to be here.
Yeah. Well, we're happy to have you here as our interim health officer. We know you've been on the position about 2.5 months now, relatively new. Can you just talk a little bit about yourself, your background, and how you came into public health?
Sure. I'm trained as a family physician and, initially worked as a family physician. As you mentioned in your introduction, I was in the Air Force. And I practice clinically, both in clinic and also in doing some emergency room care. And, in that practice, definitely learned and was able to see and recognize that, people's health was impacted by so much more than just the healthcare they receive. And so that drove me to an interest in public health. And, when I kind of left the Air Force, that's when I started working in Sonoma County as the deputy health officer, and there was able to oversee, the communicable disease programs, the public health laboratory, their preparedness programs, and then also their community health centers that they ran there. And so just being able to really see the connection between both our healthcare delivery system, but also all of the social structures in the county and, in the state that support people's health, and being a part of that is really what brought me to public health, and it's why I'm here in Sonoma County.
That's great. Well, let's talk a little bit about the role of the health officer, the public health officer. It became a very sort of visible position during the pandemic, indeed, but still folks may not know exactly what the health officer does. Can you tell us a little bit about the role of the health officer and maybe what you do on a typical day?
Yeah. The role of the health officer, as you mentioned, is oftentimes an invisible role. It is a legally required position that counties have a health officer, and it's really responsible for communicable disease control. It serves as an advisory function to the Board of Supervisors, the elected officials in the county, as well as the department heads, the public health divisions and the health services departments of the county. It also serves as a public figure in terms of educating and advising the members of the public about health risks. And, if everything's going well, the public doesn't see the health officer very much. During COVID is a perfect example where, health officers were very visible. During that time, I actually helped out and served for some time as an acting health officer in Alameda County. And so, was very familiar with the role of the health officer during that crisis where front and center, both in advising residents and also businesses about how to control the spread of COVID-19. Sometimes the public was appreciative of that and sometimes less so, but it was a very visible time for health officers. On the day-to-day, we're really looking at the data that's coming in about the health of our communities. We're constantly have teams of public health nurses that are working to do surveillance around communicable diseases. And there's always things going on around the communicable disease world that, whether it's tuberculosis or, those measles cases that pop up, and things that require a team to just make sure that we're both taking care of the individual that's infected, but also making sure that it doesn't spread more broadly to the public. And so there's teams of public health nurses that I, as the public health officer, work very closely with, and then epidemiologists, and they're really looking at all of that data that's coming in from hospitals, healthcare settings, and other sort of environmental sources of data, and tracking it. And we look for trends and any changes in that data that might signal something that we need to let the public know about. And I think we're going to talk about some of that stuff today.
Absolutely. Well, that brings me to my next question, which is winter virus season. It's that time of year again. Kids are out of school. Box of Kleenex is always visible around the house somewhere. People are off of work. We've got RSV. We've got COVID-19. We've got the flu. It's a lot of these airborne respiratory viruses. How are we looking so far this year in Sonoma County?
Yeah. What we're starting to see is some increases in influenza. I think people may have heard there's this strain of influenza out there, influenza A, subclade K, and that seems to be the predominant strain out there right now, and we are seeing it. We're seeing it both show up in wastewater. As I mentioned, we track that. We see what's showing up in the wastewater. We're seeing it there, and we're also seeing increased ER visits and hospitalizations, largely related to flu, this influenza A. We also are seeing upticks in wastewater and also in hospitalizations with RSV right now. So those are the two main drivers right now. COVID-19 is actually kind of at low levels right now. We saw some increases in the summertime, and then it came down, and it's currently remaining fairly low. So really the drivers of our season so far are really influenza A and RSV.
Okay, interesting. There's been a lot of confusing information coming out of the CDC, the federal level, on vaccines, and we'll get to childhood vaccines in a minute, but really just the flu, COVID, and RSV vaccines for now. What do you recommend Sonoma County residents do for those vaccines?
Yeah, right now is a great time to get vaccinated. As I mentioned, we're just seeing those increases right now. So we're just seeing the increases in hospitalizations. So it's not too late. We haven't peaked, and we haven't peaked yet, and we still have some time before we peak. So it's a great time to go get your influenza vaccine in particular. RSV vaccines, if you're over 75, go get that. If you're over 60, but not quite 75 yet, then if you have medical conditions that make you more vulnerable, you should talk to your healthcare provider and see if it's a good idea for you to get the RSV vaccine. And anybody that's pregnant, it's really important to get that RSV vaccine during pregnancy, in that later part of pregnancy, especially because during right now, if you have a baby, they're going to be born into RSV season, and getting RSV as an infant can be very, very severe. And so they get their protection from the mother being vaccinated. So really, those are the strong recommendations for that. So flu shot now, RSV, if you fit into one of those categories. And then while you're getting your flu shot, you might as well get the COVID shot. We are going to see more increases in COVID. So while COVID is at low activity, it's a great time to get vaccinated because we're going to see it go up in the future. So, I this season got my flu shot and my COVID shot at the same time. I'll admit I was a little bit nervous. I was like, this is going to put me out for a day or two. But honestly, it was very mild. It just lasted for the evening, and the next day I felt totally fine. So I really recommend, when you go get that flu shot, just get the COVID shot too.
Anything else residents can do to keep themselves safe from winter viruses?
Yeah, I mean, it's always important if you're feeling sick to stay home. Anything that you have, you can spread it to others. And so if you're having a cough, and you're feeling sick, particularly if you're having a fever, just stay home, rest, get better, and then go back to work or go back to school. It's good to just isolate yourself when you're feeling sick.
Yeah, sure. What's the where do you recommend people go to get good information about these viruses?
Yeah, actually Sonoma County has just launched a new website, and for that would allow you to see those trends on that new website. You can see what's happening in the wastewater. You can see what's happening in the hospitalizations and ER visits. And so that's a good place to keep aware of what's happening in the county.
This is the real-time trends dashboard.
Yes.
Okay.
Yes.
So you can find that through the county's website.
Through the county website. And then in terms of what, national level, you can still go to the CDC website and learn about like what's going on with flu, and it will talk about the strains that are out there most circulating right now. The CDPH website, California Department of Public Health, will also have information about what's happening in California more broadly.
Great. Let's move on to talk about wild mushrooms for a minute. You put out some health advisory last week about that. There has been some poisoning, a death even in Sonoma County. Why are we seeing so many cases of wild mushroom poisonings in the Bay Area this year?
Yeah, we did tragically have a death in Sonoma County related to wild mushrooms, and that prompted us to put out a press release. This year, yeah, it just seems that the weather conditions are just perfect for mushrooms to grow. I'm a person that likes to get outside and do hiking, and I've noticed it like along trails and things. You're just seeing a lot of mushrooms out there this year. And I also think people just have more interest. There's just more interest out there in foraging for mushrooms. That seems to be something that people are doing more and more these days. It's as a hobby and something that is fun to do, because there's when you go out and see mushrooms, there's an amazing variety. So they're super interesting, and so combination of like the weather conditions being kind of perfect for mushrooms to go, and this increased interest in going out and exploring this world of mushrooms has unfortunately led to people consuming mushrooms that they're foraging on their own. And then there's this death cap mushroom out there that is very, very poisonous. There's multiple kinds of mushrooms that are poisonous, but this death cap mushroom is deadly.
Is that the main one that we're seeing people being sickened by?
And that's what we're seeing. And that's what's caused the deaths in California. And even when other, the people that haven't died but have been poisoned by these mushrooms, some of them have required liver transplants. So even getting through a poisoning of a mushroom, even if you do live, there can be long-term lifetime consequences and irreversible liver damage, sometimes even requiring a transplant. So it's severe. And we're seeing more of that this year than we've seen in previous years. Again, probably a combination of ideal weather conditions and people just having this increased interest. So, our advice to people really is don't eat wild mushrooms. It really takes a lot of experience. So,
so if you do want to go foraging, as you mentioned, it is becoming a increasingly popular hobby for people to get out there, and it's a nice way to enjoy the outdoors. But if people are going to practice mushroom foraging, how can they do that safely?
Yeah, I would stick to taking pictures and finding species and, exploring and learning that way without eating. Particularly now, we know these mushrooms are out there. And even for people with a fair amount of experience, it can be difficult to tell the difference between something that's edible and something that's poisonous. So I would say for eating purposes, buy from a grocery store, a farmer's market, or someone who has the appropriate experience to really make sure that you're eating something that's safe. One of the things that's also true of these mushrooms is, once you eat it, it can take some time before it makes you sick. So even those initial symptoms that might come on, 6 to 24 hours later, those might just be nausea, vomiting, diarrhea, and then those symptoms can get better, and you might think, oh, okay, well, I ate something that wasn't good, but I'm getting better. Unfortunately, that's a false reassurance. If you've eaten one of these, if you've eaten death cap mushrooms, that's when the liver damage really sort of kicks in. And, in that 2 to 4 day period, your liver can stop functioning. And so that's a real risk there. And so if you do think that you've eaten a mushroom or not sure that you've eaten a mushroom, really call poison control right away. Go to the emergency department. Early intervention is important to prevent the most severe consequences.
Yeah. I do my foraging at Safeway, so I think I should be safe.
That should be safe, yes. The other thing that we have seen, and I think, is that pets, we've had a number of dogs dying from mushrooms as well. Those don't get reported out the same way, but that has happened. And some of these poisonings have also happened with small children. Mm-hmm. So keep an eye on your children and your pets. Make sure they're not eating mushrooms.
Yeah. Well, let's move on to another childhood topic, childhood vaccines. The CDC recently introduced a reduced vaccine schedule. It's based on a schedule in Denmark.
Yeah.
What do you think about this new childhood vaccine schedule, and does this make sense for American children?
I guess in short, no, it doesn't. We are a very different country than Denmark, both in size, demographics of our population, much more diverse country. Our healthcare system's very different than Denmark. And so the vaccine schedule in the U.S. has been based on decades of experience with the population that we have in this country. And so just adopting or even trying to mirror a schedule that's tailored to Denmark, it doesn't make a lot of sense. And we in this country have benefited tremendously from vaccination. Rarely do people get measles. Pertussis is killing a lot less children than it did years ago. And polio, I don't know personally anybody that has polio, but it is globally increasing. And so we have benefited a lot from vaccines controlling these preventable illnesses. Any delays just put our folks at risk. There was a recent change on the federal level that said, we've been giving hepatitis B vaccinations at the time of birth as kind of a universal recommendation. With the new CDC guidelines, it sort of softens that and says it's not required at birth. But that's based on decades of experience that, when we give it at birth, we've essentially almost eliminated the occurrence of hepatitis B in newborns, which is really serious. And by not protecting right at that time of birth, we're opening up a window for these diseases to kind of get back in.
Yeah.
So there's a lot of risk there to the public. Measles, I think measles is something that folks have probably heard about. We're seeing more measles outbreaks. We need very high levels of vaccination in the population to control measles. And so we have seen in California over the years, as those vaccination rates have declined slightly, we've seen outbreaks of measles. If they decline more, we'll see more outbreaks. It will happen in the schools. It will happen in our daycare centers. And that's tragic because
it's preventable.
It's preventable, and there's long-term consequences of getting those illnesses.
What do you advise Sonoma County parents to do around their childhood vaccinations?
Yeah. Here in California, there's been the West Coast Health Alliance that was formed, which is really in response to kind of changes of CDC guidance and concerns about it being really science-based, evidence-based. So the West Coast Health Alliance is Washington, Oregon, California, and Hawaii. And they come out with recommendations, which really mirror the American Academy of Pediatrics. And in Sonoma County, we support those. And so there's vaccine schedules still out there from the American Academy of Pediatrics. And we recommend that people follow that vaccine schedule.
What would be the long-term repercussions if people stopped following the American Pediatrics vaccine schedule and started following the CDC guidance?
Yeah, potentially seeing, new cases of hepatitis B in newborns, more measles outbreaks, for sure, and other vaccine preventable diseases. I mean, I would hate to see polio come back into our communities. I think there's probably listeners out there, viewers out there, that maybe do remember polio. It's been a lot of years, but there's still people alive that can remember those polio years, and we don't want to go back there. But certainly we'll see more cases of measles and other preventable diseases, more pertussis, if we start to veer off from these sort of evidence, science-proven vaccine schedules that have really done a great job of preventing these illnesses in the U.S.
Yeah. Well, on that note, we're glad you're here helping keep us safe here in Sonoma County. So we appreciate all your work you do in the community.
Yeah, I'm really happy to be here.
Yeah, thank you. Thank you, Dr. Stacey. And thanks for being here on SoCo Chat. As a thank you to for being our guest, we want to present you with one of our SoCo Chat coffee mugs here.
Excellent.
And to our listeners, if you have comments about this episode or have a suggestion for a future SoCo Chat discussion, please email us at publicaffairs@sonomacounty.gov. Thank you all, and we hope you continue to follow SoCo Chat on Spotify, Apple Music, Amazon, and of course, YouTube. See you next time and stay healthy. Thanks again, Dr. Stacey.
Yeah, you're welcome.